Hello there. This is Delbert. I just got done with my second BCG treatment, and I thought I would rewind a little bit and tell you how I got here. About a year ago, I was having episodes which felt like a urinary tract infection. I'd have to go to the bathroom, and it would sting like a son of a gun. And it started happening more frequently, and I got concerned, and that's what got me to the urologist to start with. Um, After about, I don't know, 3 or 4 months of this, and the doctor trying to figure out what's going on and what we're going to do, all kinds of blood tests, all kinds of pee tests, and everything. All of a sudden, I had an episode one night where I was having to go pee like every 2 minutes. I'd barely get out of the bathroom and I'd be running back, and the pain was through the roof. So we decided to go to the ER. I went to the ER. They did a bunch of tests. They looked at my bladder through some x-ray kind of device and said, "No, you're empty. Don't have any idea why you're going this often, but you got to go back and see your urologist." The only thing that they could offer me was to put in a catheter, which would help me get some sleep that night and get to the urologist, the next day or two. So we did that, put it in. Doggone thing was like a McDonald's straw. First time I've ever had one. I didn't know what to think, everything. So I had it in for about a day and it started leaking. And I read a bunch of stuff online and it was like, okay, we can pull this thing out. You cut a little tip off of the end of it and it drains some fluid that is in a ball inside of you. And once it's drained, you can just pull it out. It's about as uncomfortable as pulling it out as it was putting it in, but I'm getting the old hat at it now. I've had probably three of them now. But in any case, got back to the urologist. He said, well, we're going to need to go in and take a look. In his office, he did a flexible scope. He looked around in there, didn't like what he saw. He said, okay, we're going to have to schedule it for a surgery. The doctor scheduled me for a surgery. We went in. It was probably about a month later to get into the surgery center. And he went in there and he did a TURBST, TUBST, I think, and basically cuts away a lining of irritated skin that he believes is cancerous and takes a biopsy piece. So he took the biopsy. I wake up. I've got a catheter in me, which I knew was coming. I went home, lasted about 36 hours on the catheter, had to cut it off, get it out of me. I don't do well with catheters. I blow by them, I leak everywhere. Horrible. So about 2 weeks later, I go back to his office and he's got the test results from the biopsy. And yes, it is confirmed that I have bladder cancer. Um, but he didn't get enough of the muscle, so it was inconclusive if it was just in the lining or if it was in the muscle. So he gives me some medicine to take, and we're going to watch it for a little bit. He gives me the options of the treatments, and he says the problem is he can't get BCG treatment. He just can't get it right now. There's a worldwide shortage, and we're going to have to figure out something else to do. I went to my oncologist because can, bla- I had colon cancer before, and my oncologist said, well, the best I'd ever do is send you right back to your urologist who would put BCG in you. So we go on a few weeks, maybe a month of going to see the urologist and talking about different things. And then all of a sudden I get a call from their office that my urologist is changing offices. He is going to go on the other end of town. And the nurse wanted to know what I wanted to do. Did I want to follow him over across town? Or did I want to go to a new doctor? I told him the wife was rather upset that they weren't aggressively going after this cancer and that we were going to go to a new doctor anyway. And I decided to go to a different doctor in my existing office. I go and have a consultation with that doctor. He tells me he has no problem getting BCG. Yes, there was a shortage, but he's got some. and which really confused me and really made the wife mad. But in any case, um, he said before starting that though, he wants to go in and do another scope in the hospital. And we set that up. That happened about a month later. They went in there, did another TERPS, you know, took this little electric scalpel or whatever and cleared out the lining, took another biopsy, this time got more of the muscle, and woke up the next that day after the surgery, and this time I was in pain. This time everything hurt. I think the anesthesiologist was concerned and didn't give me maybe as much painkiller as I would have liked. But in any case, I went home. I lasted for about 48 hours, 2 days, with the catheter in me this time. Got frustrated with it again, cut it out, pulled it out, cut the little tip, drained it, pulled it out. Again, if you have a catheter and your doctor supports you on the idea of you just taking it out on your own, it's perfectly fine. It worked really well for me. I wouldn't waste my time going into his office to have their nurse do exactly what I can do in my bathtub. In any case, so we wait about 2 or 3 weeks. We get the biopsy results. This time it's confirmed again. Yes, I have cancer of the bladder lining, but it is negative for the muscle. So it's really great news. So he sends me home with some medicine that's supposed to help make it a little bit better from the having to go to the bathroom and the pain. And we wait. We wait for the bladder to heal and all of that. And that took about another month. And then I go in for my BCG treatments, which is what the first video was about. And now I'm on Friday. I had my second BCG treatment on Wednesday, 2 days ago. Um, just prior to that treatment, starting Tuesday morning, I was starting to have some pretty bad pain when I went pee again, but I couldn't really attribute it to the BCG treatment. It was just my old friend, that pain when I go pee and maybe having to go pee more often. My normal process with that is to drink as much water as I can possibly get down me so I can pee any gremlins out and get rid of them. And it usually works for me. It takes a while though. It usually takes 8 or 10 hours of going through it, but then it subsides. Um, but like I said, Wednesday I went. This time I'm on my second BCG treatment. I sat down on the chair. She let me lay back. She put the little teeny catheter in. Everything worked really, really well. She drains any urine that's in there. She syringes through the catheter the BCG treatment. All that worked really, really well. Um, Sent me home. Been fine. You know, Wednesday night. Thursday, I ended up with a little bit more pain, but again, I can't attribute it to the BCG. It's a normal thing. Um, I'm on Friday now. Most of the pain subsided, and I'm looking forward to my weekend. I hope these videos help you. If you are getting ready to go through this treatment, you are welcome to reach out to me. More than glad to be a friend, a mentor, talk back and forth about experiences. But the whole goal of these is to help the next guy that has to go through this. He can see the average person talking about going through these treatments and see it for yourself. Till next week.